Welcome everyone to our webinar today, Fueling Health and Learning, Lessons from the SBHC National Food Security Survey. Some quick reminders, all of you are in listen-only mode, but we invite you to ask questions using the Q&A icon that appears at the bottom of your control panel. The chat is disabled for now, but we'll be able to use it to share resources and events and links and things like that throughout the presentation. And then we do have just some quick evaluation poll questions at the end. We invite you to answer those and give us some feedback about how we did today and how we can improve for next time. I'm excited to introduce our presenters today. We have the lovely Addie Van Zwal, a director here at the School-Based Health Alliance. Our partner, Sarah Mills, works for Share Our Strength, which is a division of No Kid Hungry. And we also have Catherine Cushing, who is another director at the School-Based Health Alliance, who is here to talk and share all about the data that we collected from our survey. And our objectives today are that you all will be able to describe trends, challenges, and promising practices identified through the survey and identify options to integrate food access initiatives such as screenings, referrals, and partnerships into care models to support student health and academic performance. And with that, I'm going to pass it to Addie and Sarah to talk about our partnership.
Awesome. Thank you so much, Harper. Hi everyone. Like Harper said, my name is Addie Van Swell, and wanted to give you a little bit of information about the School-Based Health Alliance in case you are not familiar with us. We work to improve the health of children and youth by advancing and advocating for school-based health care. We have supported and advocated for high-quality health care in schools for the nation's most vulnerable children, working at that intersection of healthcare and education. We are recognized leaders in the field and a source of information for best practices for our partners and policymakers. We focus on policy standards, data, and training to support and grow school-based healthcare, particularly school-based health centers. With that being said, I'm going to pass it to Sarah to talk a little bit about Share Our Strengths No Kid Hungry campaign.
Yeah, thanks, Addie. Hi, everyone. Really excited to be here with you all today. For those of you who might not be familiar, Share Our Strength is a national anti-hunger nonprofit dedicated to ending hunger and poverty for children and families. We created the No Kid Hungry campaign to make sure that every child in the United States gets access to the healthy foods that they need to thrive. And we also work on strengthening the federal and state nutrition programs that children depend on. We do this through a variety of methods and working across the country with organizations through grant making, advocacy, research, and just providing technical assistance to schools, healthcare organizations, nonprofits, and state agencies in their work to end childhood hunger. And we've been working alongside the School-Based Health Alliance for almost 4 years now, and many school-based health centers and state affiliates in their work to address food insecurity for the students that they're serving. So I'm going to pass it back to Addie to talk a little bit more about some of the resources and things that we've done together.
Perfect. Thank you. So as Sarah mentioned, we have been working together since 2022 when we launched a learning collaborative with 16 school-based health centers across 12 states. And through that work, we were actually able to create and launch a toolkit on promising practices and lessons learned. So Harper, thank you. You already threw it in the chat before I could say she was about to do that. But this toolkit is updated regularly. So as we have continued working with No Kid Hungry, we've continued to update that resource. So constantly adding things to it. Definitely encourage you to check it out if you haven't already. And then between 2023 and up till now, we've been working with the Ohio and Colorado school-based state affiliates, and we really helped kind of support them create a learning network themselves, and really kind of support that work at a more local level. In addition to that, we created a number of tools and resources. So there was one related to practical tips for interventions. We also had a school-based health center specific SNAP flyer that's available to anybody who wants one to hang in their school-based health center. We still have those available. And then we also created a resource on kind of addressing food security on a continuum. So looking at different strategies to help support students and families. So whether that's opening a pantry, having a backpack program, or simply, screening those kids and families for federal nutrition programs. We also did a webinar series. And what we talked about, or what we're going to be talking about today, is our national survey. And we do plan on continuing to work with No Kid Hungry, with SNAP in schools, and really kind of building on the partnerships that we have made thus far. With that being said, I think we're passing it on to Catherine to talk all about our national survey.
Thanks, Addie. And a huge thank you to Sarah and the team over at No Kid Hungry for making this possible. I know we started looking at SBHCs and social needs screening and social determinant screening way back when we were looking at the results from our census. And for those of you who are interested, you can find that on our website. And really said, I really want to know more about these school-based health centers and what they're doing around food security screening. And so a big thank you to Sarah and the No Kid Hungry team for thinking that this was important to dig into too. And also a thank you to you all for joining this webinar and being excited about data. So give yourself a little celebration, because data's fun and it's wonderful. And I'm glad you guys are all here to get this update. Moving right along. So a little bit of background about our methods and sample. This was conducted as an online survey that was open from May 15th to June 27th, 2025. So capturing that end of the school year. And we recruited all known SBHCs. We did this through our digest blast, an e-blast, and social media. There were incentives. Participating sites respondents received $50 in an Amazon gift card. I will say that our sample was small and many people didn't know about our incentives because we had a wonderful challenge with some bots. So we're not able to promote our incentives the way we would have liked to. But we had a great response anyway, and we were happy with our results. But one of our limitations is our small sample size. So our sample is 248 SBHCs representing 53 sponsors. Our regional distribution, we had 70 sites across the Northeast, 62 in the Southeast, 28 in the Midwest, 10 in the Southwest states, and 78 in the West across 5 states, which does represent some of the distribution nationally too. The topics of the survey included screening, referral, and follow-up practices was primarily what we were discussing. And we were digging into staff responsibilities. Who at an SBHC is involved in screening, referral, and follow-up for food security? How often is this happening? What's really going on the SBHC, and what are the students experiencing? What does this look like for them? What tools are being used? How are folks going about this? And what barriers are they encountering to screening, referral, and follow-up, as well as data collection and management practices? We also asked a bit about SBHCs providing direct food support services, such as a pantry, market, produce coupons, those kinds of things. Some are doing gardens. So we asked, what are you doing in terms of direct food service, as well as the barriers and how are youth involved in that? And with no more pause, we are going to dig right into the results and a lot of charts to come. So our first question was screening, referral, enrollment, and follow-up. How common is it? What is really happening with this? And we were able to see here that over 85% of SBHCs who responded to our survey are screening and referring for food security. There are some that provide referrals that are not contingent upon screening. So you see this 87 of referral being a little bit higher than the screening practices. Fewer SBHCs are engaging in some kind of follow-up here. So you see this drop down a little bit. And within that, we started digging into, okay, it's happening. Who is doing it? And among our sample, primary care providers are the most common staff conducting screening, followed by behavioral health providers, and less often the non-provider staff. Now, one thing to note is that this is not adjusted to the staffing models at each SBHC, so we do know that some sites do not have all staffing options. They may not have a primary care provider to be doing this or a case manager, so that is not reflected here in our adjustment of data. We asked then, okay, that's who's doing the screening. How about the referrals? And referrals kept largely the same staffing trend with mostly primary care providers, your physician, nurse practitioner, physician assistant. Some happening here with the behavioral health provider, like your licensed social worker, counselor, therapist, or psych nurse practitioner. And then some with your registered nurse, medical assistant, health aide. And bumping up a bit here for the folks who have a case manager, care coordinator, or community health worker. And then we checked out enrollment. Who's helping with the follow-up enrollment or use of services. And you can see here, this is where providers start to drop down. And then the community health worker, case manager, care coordinator is coming up again. So you can see this kind of change in responsibilities over time. And I should add that my wonderful colleague Lillian is here answering questions in the chat. So if you have questions about the data, feel free to drop them in the chat or the Q&A, and she will get right to responding to you. We asked about screening. How formal is this? What kind of structure is in place? We wanted to know more about what screening looked like once we knew it was happening. And we had over 80% of the SBHCs who responded to us who said that they have a formal workflow for food security screening. Which of course led us to what tools are used. And over a third are using Bright Futures. A third said they use what is pre-programmed in their EHR, some of who specified what this is. This is a multi-select question, and others who did not. And a quarter who are using a tool developed or modified by the SBHC or the sponsoring agency. Also relatively common was RAPS, but you also saw here 8% saying we don't use a screener for social needs. So there is some variation here in people saying, well, we use one that we've kind of made up, or we don't use one. A small portion who said we screen, but I don't really know what we screen. We did give them more options in this. In the list of like 20, we cut off the ones who said no one is using this, and just showed theirs. We are asking also who gets screened. Once we knew, okay, this is what it looks like in terms of implementation, who are you actually screening with those screening tools and that screening workflow? And over a quarter of SBHCs that screen do active outreach to ensure all consented students are reached. So you see that here in that 27%. They're looking at getting everyone consented for services. They're doing outreach to students who are missing screenings, even if they had not had a visit to the SBHC. But the majority, 67%, are screening those who come in with a visit. So they're waiting for the folks who come in, the students to come in and have a visit. Even if it's for another reason, they're getting them screened then. And a small portion, 1%, is looking at screening the entire school, whether or not they are specifically consented for SBHC services. They are working with the school to get the entire population screened for food security. We also wanted to know how regularly is screening happening. This is something that came up with our work with Colorado and Ohio, where we are saying, okay, folks are screening, but how often should a child get screened if they come in for services? How regular is that? Does it happen on a regular basis? Does it happen as needed? And so when we asked this of the sample, we had 65% are screening at a specified interval, and 35% said we're screening regularly, we're doing it as needed. There's no specific consistent intervals that dictate when this happens. We do it as needed. And we wanted to know with that, okay, that's how regular it is, but how frequent is it really? What does that look like? Because you could be doing it regularly, and you could be doing it, well, regularly I do it for every student every other year, or you could be doing it regularly, every visit they come in, no matter what it is, they get a screening for food security. And when we found these results from our sample, we found that about half are screening annually. 22% are screening a few times a year, and 12% are screening at every visit that a student comes in for. And then the 10% looking at other had things like, it depends on the provider. We don't have a specific policy at our SBHC about how often this happens, how frequently it happens. So it really depends on who's seeing the student. We asked them, okay, what barriers exist to screening? This is what it looks like. Why does it kind of look like this? What's going on? What challenges are folks at SBHCs running into around screening? And you can see the top one coming up here. Students don't always know answers to screening at 63%. They have difficulty reaching caregivers to confirm responses, 61%, and limited referral pathways, 52%. And if we kind of start digging into this, and we can give them a little label here. If we label the ones that are kind of student and family focused here with a little orange graduation cap, things about the SBHC infrastructure with a little purple school/SBHC, and community partnerships with this little blue handshake. You can see the top two coming out about student and family, but here the third one is really about partnerships, limited referral pathways, and then quite a few here, but not as common, falling into things that are falling within the SBHC infrastructure. Like, we just don't have time. We've got things to do. We don't have a screening policy. We don't have the technology, and staff are just not trained in administering the screenings. So when we looked at this, I said, okay, but I really want to know about the barriers dependent on, are you screening or are you not screening? Because you imagine, right? If someone's not screening, their barriers for screening are probably different than those who are already doing screening. And you can see that start to get broken up here with, when we look at it, our response that the barriers for sites that reported that they do screen, 58% of the respondents screen and report that students do not always know the answers to screening. And that drops down to 5% of those who do not screen reported that they don't always know the answers. What we started to look at here was this kind of change, right? Here, around 10%, this is where those that do not screen, this is coming up with the biggest proportion of their barriers, right? So if you look back, it's like not having a formal screening policy, not that much of an issue for the folks who do screen, but rising to the top among folks that do not screen is the fact that they just don't have a formal policy to do it. No one's in the SBHC has said, hey, we should do this. This is what happens once the student comes in. We also asked them, do you check for other social needs when you're screening? If we look back at those screening tools, we know that many of them capture multiple categories of social needs. And so yes, most of the respondents do check for other social needs. They're not just doing a food security screening and moving right along. They're looking at other things too. But for the sake of this work, we did kind of narrow down on food security screening because that was what was relevant here. We also wanted to know, is it sustainable? Can SBHCs keep doing this? It seems like a great pathway to be able to identify students and refer them to resources. We want to make sure that this is something that folks can keep doing. So we asked, does your SBHC have staff capacity can continue screening efforts? And almost 90% of them said, yeah, we can continue doing this. We said, okay, is food security screening at your SBHC supported by state or federal policies? And 54% said yes. The states where that kind of is rising to the top among our respondents was New York and Louisiana. And that was mirrored again with, does your SBHC have stable ongoing funding availability for food security screenings, which a slightly fewer saying, yes, we do have stable ongoing funding for this. Most of those responses coming through from New York and Louisiana. And this is where I started to get really nerdy and really excited and said, great, we love that SBHCs can screen on fur, but what happens then? What happens after they screen a child and they say, okay, you either are coming up as food insecure or not. What is the outcome then? What pathways do folks take in this process? And so we asked about, are you referring students to local food banks or pantries? And you can see here about 75% saying, yeah, we're referring students to food banks or pantries, right? So both of these, the teal, dark teal and the orange is kind of the combined version. If you look at this closer, you see yes, for those who screen positive. So 60% of SBHCs are referring to local food pantries for those who screen positive for food insecurity, who need support. 16% are referring regardless of the results. No matter what a student shows, they are referring to local food banks or pantries. A smaller portion, over 60% here, are referring to SNAP or WIC, and you can see that once again, that is largely for students who are screening positive. Providing information for school meal programs is less leaning about the same, but that's coming up with more of, regardless of screening type, they're starting to be like, well, more folks do that just for anyone. We tell everyone about school meal programs. And starting to drop down a little bit around following up with families and referrals to confirm enrollment or service use. And you could see that when we were talking about, well, does your SBHC do any kind of follow-up once students have been referred? And that number back at the beginning was dropping down. And you can see that consistently here. And then a few sites here providing on-site enrollment for SNAP or WIC specifically. And because I know there's a lot of charts and I love data, but I also love qualitative data. Some quotes about things that are going well, we asked in our survey. And one site said, our goal is to assist families to be able to become self-sustained. And we are seeing that happen. Some families have been able to be removed from our pantry list because they have learned how to utilize resources that provide deeper assistance and assist them with federal and state programs, including employment skills and application processes. So it's nice to see directly from our SBHCs the fact that they feel like they are making an impact on students and families here with their food security work. And you can see here them talking about having a pantry specifically. And because I love data, I also had to ask, okay, but are you tracking access to these services once you refer students to them? And so we asked this as, are you tracking at all, right? Yes. You can see that at like 66%. Yes, we are tracking it all. And then 43% track and outcomes and follow-up with students and families. And 23% saying, yeah, we track it, but we don't really have a formal process for it. It's inconsistent. We're doing the best we can to kind of follow up with families where we can and make sure that they're getting connected to resources. And 33% saying, you know, that's not on our plate right now. We're providing referrals, but we're not tracking follow-up. And I wanted to know what would help make that possible. What would help make screening and follow-up and getting students connected to services easier? And you can see here, the top one coming through is more community resources to which to refer students and families to. More staff training on food security and referral processes. 57% saying more awareness about resources to which to refer students and families. 55% stronger engagement. And if we go back and we kind of think about our categories again, and we look at, okay, that partnerships aspect, you see that really rising to the top, right? In these top 5 categories of ways that could help make this easier for SBHCs, 4 of them are about pathways and referrals and stronger partnerships with community food organizations, culturally appropriate food for student populations. How do we make sure that once we screen them and can refer them, that there's somewhere for them to go? There are resources available for them. So we're seeing here again, the importance of SBHC and community partnerships and making sure that students have resources. And I wanted to know, how is impact tracked and shared? Basically because my team could not hold me back from wanting to know, how do we know about the impact that food security screening is happening on youth? And so we wanted to know, is this data going into EHRs? Yeah, 70% of SBHCs, when they're screening, are getting their data into the EHR. However, only 55% of the SBHCs have the ability to extract their screening data, including the number of students screened, the number identified as positive, the number referred to support services. And then you see 12% are able to track food security over time. Quite a bit tied to this. Well, we can't get our data out. We don't have the time to look at it. So how do you engage in quality improvement when there are barriers here around reviewing your data and looking for ways to increase the number of screening, referral, and follow-up that is happening to make sure that students are receiving the services they need? And you can also see there that only about a quarter are using a resource and referral software to facilitate some of this happening, such as Unitas or 211. And what would make it possible to document that impact? What would help SBHCs show the impact that they're having around food security screening? And 54% said an increased staff capacity for data entry and analysis. We know that SBHCs are typically small in staffing and very nimble in what they do and how they make it work. So asking one more thing around data entry and analysis is a burden. And then how do we make sure that food security screening is getting into existing EHRs or whatever school system, if that's applicable? 52% said that would help impact. You're seeing less issues on training and management. Largely, if you don't have time to do it, training doesn't help a ton. And funding for technology or software improvements would be great. But once again, raising to the top, time to do this, and standardized collection tools or templates. We can look back and remember that the tools that folks were using, a lot of them are SBHC specific or sponsor specific, how to standardize that across the field. So then we started to ask specifically about, okay, so what's really going on here? What's happening with SBHCs? What are they doing directly for students and staff? And so we asked, are you doing these directly? Are you doing backpack food programs, on-site food pantries, school or community gardens, providing vouchers for fresh produce or farmers market, or some kind of other program? And we said, well, this could really be an SBHC-led initiative, but we know that sometimes school-based health centers are able to collaborate on this with their school partners. It's something that they co-led. So we also asked about that. And we know that SBHCs cannot be leading everything, and that some of these things might be already existing with their school partners, and it's school-led, and they can support that and make sure students have connections to it, but they're not the ones leading it. So when we asked about this, you could see that backpack food programs are the most prevalent across the board amongst our responders. Only 1% of our responses were doing backpack programs through directly as SBHC or led or housed programs. But 43% had school partners that were. So that is a resource that already exists. The SBHC does not have to duplicate that. How can they make sure though that the students that they're screening positive can get connected to those resources? You bumped up a bit here on SBHCs having an on-site food pantry. So about 10% of SBHCs have their own food pantry that if a student screens or if they're referring anyone, regardless of screening, making it available to all students, students can come in and get snacks from the SBHC food pantry. 20% of these are housed in school-led programs too. So if it's not at the SBHC, they can go in and see what is happening there. But you can still see here that 50% of SBHC respondents said this isn't happening at our school. This doesn't exist.
Hey, Catherine, welcome back.
Thank you. Thank you. Don't you love it when your Zoom crashes in the middle of the webinar?
No worries, happens to all of us. Are you able to reshare your
I
screen?
am. Yep.
Amazing. Then we'll just jump right back
We'll
in.
jump right back. Right? Don't we love this?
We were on.
We're right here. We're talking about food support programs.
Yeah, it's like you never left.
It's like I never left. I'm just really, trying to keep things interesting here, and don't we love it? So 5% of SBHCs who responded did say that they are providing vouchers or fresh produce for farmers markets. We know that that's common. And you can see that's kind of split in responsibilities evenly among SBHCs and schools. But overall, still, that's not a huge program that's happening across SBHCs. And there were some folks who were doing other resources. Let's see. Sorry, folks, when it dropped. Okay, other things such as food pantry bag pickup, grocery delivery. We know some folks have their community health workers who are going door to door when possible to drop off food. So not necessarily an on-site food pantry or backpack program. But here's another example. Our SBHC partnered with local farmers to provide fresh produce boxes bi-weekly to hundreds of families within the community. We also educated families on how they can best use the produce to make healthy meals. The kids really loved these boxes and share their excitement on how they were able to use them at mealtime. And as someone who has worked in schools with students, I know that when they come up telling you about something that they were able to implement with their family, oh, I was able to do this, their excitement is palpable. And so big kudos to the SBHC partners who are able to make this happen and see the true impact that they're having on students and families. And Harper, shout out to you and your work leading our youth development work because we really wanted to know, okay, this is really great that SBHCs and schools are collaborating or leading work to address food security directly. Are the youth themselves involved in this work? And you can see here that most of our respondents said that they do not have youth involvement at this time. And yes, that takes work. And 41% said the youth have opportunities to provide input. So they are not necessarily here guiding decision-making. You can see only 3% of our respondents said that youth guide decision-making. And no one said that youth are leading program components autonomously with oversight. So there is some room here for youth to become more involved in the programs that SBHCs and schools are leading to make sure that they are engaged and they're involved in what is available to them. You can see here, we asked, okay, if they're involved, what does that look like? What is the focus of this? And only 55% said that there's service learning, and 48% said that they are doing career exploration in health, nutrition, or agriculture, and 6% said it was leadership training. So what a wonderful opportunity when youth can be involved to help them look at different careers around healthcare, around food security, around support for students and service learning, as well as helping them learn how to be leaders, how to overcome challenges, how to work through programs and work with other adults to implement and students to implement programs. We also went back and said, okay, so what barriers exist around your direct food support programs? What kind of challenges are you running into here? And we saw that a lack of awareness of available programs was coming up around 72%. So the biggest problem reported by our SBHCs is that folks are just not aware that these services are available to them. Another one coming up at 60% is stigma. Stigma existing around getting help, someone knowing that you are food insecure. Oh, someone might see me go get support. Another one, almost 50% said the program time or location is just not convenient for families and students and families. So it's inconvenient to use the programs that are available to them. There are a lack of options or autonomy around the food or support they receive. So a third of our respondents said there are options, but the people who use them don't really have any autonomy over what that looks like for them. And a third seeing that services do not have enough resources to meet needs. Once again, we can think back to the barriers that were identified earlier around screening referral, so many of them coming up around where do we send people? What are those pathways? What are the community resources? And how do we make sure that we can send students somewhere while still seeing that services not having enough resources to meet needs is coming up still as a substantial barrier to using food support programs. And then not as much of an issue, but still present, was the lack of confidentiality using or receiving services. Students or families going to receive their food support programs being seen by others in their community, others knowing that they need this support. And so we knew when we looked at, well, what are the greatest barriers? Is it around awareness? How are SBHCs promoting resources? What does that look like in terms of promotion? And 67%, winning by a long shot, said to post or provide materials in the SBHC. So for the most part, all of the materials in the promo is directly in the SBHC. They're controlling the environment that they are in immediately. Less than a quarter are posting materials throughout the school. 20% are posting on social media, and fewer are putting the materials through the community. We have a couple who said they do other approaches, and fewer who are doing any email or mailing materials directly to students or families. So a large reliance on awareness of programs coming through students and families entering the SBHC, having an appointment, getting screened, and being made of materials either as posted on the wall or resources handed to them. It largely relies on students and families coming into the SBHC. And I wanted to know about food support programs. What barriers are there specifically to funding? What barriers are there to making this possible? And 60% of our respondents said there just is not a dedicated funding stream available to making food support programs possible. A third said that there are competing priorities for funding within the school or the SBHC. If you have a budget that you have to stick to, where is it most important for the resources to go? A third also said, we just don't have any capacity to apply for or manage grants that would be funding these programs. It's just not where we're at right now in terms of staffing and resources. And similarly, a third said, the resources in the community, there just are limited resources. Even if we had funding to do this, we don't know that we could make it happen because of the lack of resources in the community or limited food at food banks, right? And you've seen that coming up again and again. The results is there need to be places to refer to students to. Those places need to have resources. And if they don't, it kind of impacts the whole chain backwards all the way to why am I screening if I have nowhere to refer students to, and places I have to refer students to don't have resources to support them. And I broke this down by thinking about, okay, well, what if you told me that in the earlier question that you do have stable ongoing funding for food security screening versus those that don't? And you can see here, I think as expected, those that do not have stable ongoing funding said that this was the biggest issue, right? This is where their barriers are, is we just don't have the funding. Whereas those who did report earlier that they have stable ongoing funding are still saying, well, you know, it's not that stable. I don't have a ton of funding. You're seeing it a bit here, but you're also seeing that this is rising more to the top here around limited resources or access to food in the community, and availability at food or food banks. So you can see kind of the flip or the details here around lack of dedicated funding streams. There's some details there about who that is calling out, who that is the most important to. And really wanted to dig in some more to this idea of stigma-related barriers. It's great if there are resources, but if students or families are uncomfortable using the resources, then the impact is diminished. And so we wanted to know what is happening. Are you seeing these stigma-related barriers in your community? So we said 58% said that users have a fear of being judged by peers or school staff. 46% said misconceptions about who qualifies for assistance. That's something that we can clear up. 33% said that there are cultural beliefs about seeking assistance that can be a barrier. And 26% that they had said that they have concerns about confidentiality or privacy. And also with this, we asked, how are SBHCs addressing stigma? And about 50% said, well, we're working to address stigma by providing universal screening to normalize food security discussions, right? If students are screened regularly, regardless of what they're displaying, that minimizes stigma because this is just something we do for everyone. It's part of our SBHC policy. We just do universal screening. 27% said we don't actually have strategies in place right now to address stigma among our clients. And 25% said we're using confidential referral and support systems. 16% are doing staff training on trauma-informed and stigma-free communication. And 15% said, you know, we're looking at this school-wide. How can we engage in school-wide campaigns to normalize food assistance programs? We're making this seem like it's something that happens everywhere, and there's school-wide awareness campaigns. And 7% have brought in youth directly to do peer-led initiatives or to use student ambassadors to make this seem like something that it does not need to be stigmatized. And to wrap us up a little bit here with what's going well, I said we've been able to build trust with families that support a reduction in stigma around food insecurity and openness to accessing resources. We collaboratively with our school contact have gotten families set up with SNAP and given them resources about community options that they didn't know existed. We work with a lot of newcomers, and helping them find safety and clarity in resources they can access has felt meaningful. So as we wrap up, our key data takeaways come that SBHCs are screening students for food security and providing referrals to resources. Fewer SBHCs are conducting follow-up, but where this happens, it is most often supported by non-provider staff. Community partnerships and referral pathways are crucial to making this work. And we have some questions about how can systems and partnerships support closed-loop linkages? And what opportunities are there to engage in quality improvement to maximize reach and impact? We know that some SBHCs lead food support programs to provide resources directly through a pantry or by providing vouchers to other programs. What are the opportunities here for SBHCs to engage youth in this work? And we know that, as always, SBHCs are working beyond direct clinical services to help support the health and well-being of students and families. And we are identifying opportunities to message the impact to key players in the community. How can we make this more well-known? How can SBHCs brag on themselves to say, look at the impact we're having beyond our clinic walls? So with that, we will prompt to enter any questions into the Q&A box, and we can take a look at getting any answers to those as we wrap up the webinar. And I'll hand it back over to my wonderful partners, Addie and Sarah.
Thanks, Catherine. There was a question in the Q&A regarding using Find Help to close the loop on referrals. So I think Lillian was kind of typing away, but if you or Sarah have a response to that, I think it would be helpful. I know, you know, I think some school health centers use that Find Loop system, but definitely curious if you have a suggestion there.
That's great. We love everyone using resources that are available to them. And yes, slides should be available. Oh, I see Harper's getting that answer typed in, but slides will be available.
I'll just add, Addie, for the question about Find Help, that there are a lot of different types of healthcare organizations that use Find Help. It's similar to Unite Us and other referral platforms. I think often if a school-based health center is, if your sponsor organization is using it broadly within their system, you might have access to it then. I think that there's definitely benefits with those types of electronic referral systems, but it really still just comes back to how well the community partners are connected into that system. It's nice on the clinical side to be able to track, the referrals going out, but it depends on the fact that the community partner on the other side is using the system in order for you to be able to see a closed loop on it.
Thanks for providing that additional context, Sarah. That's helpful. There was also a question about, it says, would you begin a system, like what's the first step? So what would be the first step? I have some ideas and don't know if you want to answer this, Sarah or Catherine or.
I mean, Addie, you're the programmatic one, but from my experience, I would say gathering a team and identifying roles so that you're getting the input of your school partner, your SBHC, to think through what does a formal protocol look like for screening. And obviously, I would love to see a family or a student representative involved in that. Addie, thoughts?
Yeah, no, that's great. I would have said the same thing. I think that, having the conversation in making sure people understand what the ask is and what your capacity is, right? Because I think sometimes when we think about addressing, or what we've heard, like addressing food security, we want to address it, right? But then I think we've also had the pushback, and I think some of the data also supported this too, around, well, if we screen for it and then we don't have a resource in the community, then what, right? So like having these conversations like upfront to figure out like, okay, what are we going to do if this happens? And really just getting everybody on the same page, making sure you're talking to your school partners because they may have resources that they provide their students and families as this issue comes up, because this is definitely an issue that arises to the attention of school social workers and counselors, and so having conversations with them as well to really understand the needs of your school and the community is really helpful. So I know that was a lot of steps. You asked for like the first step and we just told you a bunch, but I think just having that open dialogue will really go a long way.
I think that question leads really nicely into our final slides about some of the resources and things that we have available for school-based health centers. So the toolkit gives some really practical examples and some tools that you can use when sort of doing that readiness. Like what needs to be in place before you start a screening program or a food security program on site at your SBHC. How do you do asset mapping to identify who are the community partners in my community that I could potentially refer to. So definitely recommend folks use the toolkit. We also have many resources on our project website that is a part of the SBHA website. So this, practical tips and resources, again, kind of walks through sort of that step-by-step, like our suggestions, I guess, of how to think through getting something started at your school-based health center. And then, other resources as well that Addie had mentioned earlier in the webinar, SNAP outreach flyers, and also kind of an overview of different ways that you can address food insecurity, from just doing general outreach about food programs to implementing a food pantry at your school-based health center. And then the final resource that's on this slide is a link to our No Kid Hungry Center for Best Practices. There's a lot of resources on that website as well, just about generally about different food programs, school meal programs, summer nutrition programs. So if you are just interested in getting more information for yourself so that you can be informed to share with the families that you're serving, that would be a great resource. And then what's next? So really thank Catherine and Lillian for all their work, and of course all of the SBHCs who responded to our survey. We really appreciate it. It's been so helpful to kind of see what is happening across the field with food insecurity screening, because it helps to inform us in what resources are helpful and what else needs to be developed to support you all in this work. And I think like Catherine said, one of the big takeaways has been this, importance of developing partnerships and doing this work collaboratively in your community. And so what we're looking at as sort of a next step in this work is really approaching it more from that collaborative standpoint of, it's not just the SBHC's role. They have an important role to play. And we think screening and, your expertise and the trust that you have with families is really critical to be able to share resources and identify families that might benefit from food programs or food resources. But it's not all on the school-based health center. And so how can we build a collaborative intervention that includes school-based health centers and the school and the community partners and state agencies? Like, how are we really bringing everyone to the table to address food insecurity on that like holistic level, with everyone kind of at the table planning, so that we can create those warm handoffs, and that we know that families are going to have the resource on the other end when we refer them. So that's sort of where we're looking to go next. And we invite you all to stay tuned as there's opportunities to be involved going forward. And then, we are going to continue to develop resources and tools to help you all in your work addressing food insecurity.
Alrighty, everyone, thank you so much again for joining us today. We would love to share that as the School-Based Health Alliance is doing a fall learning series that offers continuing education credits. Registration is coming very soon, so just be sure to hold these dates on your calendar. We've got a lot of great sessions from covering a bunch of different topics and areas of expertise, and we would love to see you there. So yeah, just add this to your calendar. And then lastly, would love to just share ways you can stay connected with us, including our digest and our social media. This is a great way to just stay up to date with all of our events, opportunities, and new resources that come out, all the time. So thank you all so much again for joining us today. It was lovely to have you. The recording and slides will be posted likely next week and also will be shared with you via email. But feel free to reach out if you have any questions, and have a great rest of your day.